Hello, my name is Leslie Porras and I'll be teaching you how to measure blood pressure. Prior to taking your measurements, make certain the patient does not consume nicotine or caffeine in the 30 minutes prior to the measurements. The equipment you will be using are the stethoscope and a blood pressure cuff. Make sure the patient is wearing a short or no-sleeve shirt to ensure accurate readings. The patient should be seated and resting with their back supported for at least 5 minutes prior to the testing. Their arms should be elevated to heart level in order to obtain an accurate reading. After ensuring you are using the correct cuff size, the blood pressure cuff is placed around the patient's bare upper arm. When placing the stethoscope in your ears, remember to keep the earbuds, or prongs, facing away from you for a clear cord-cough sound. Put the bell of the stethoscope over the patient's brachial artery, which is in the medial portion of their arm, above their antecubital fossa. Turn the valve to the right and inflate the cuff until 200 millimeters of mercury. Once this value is reached, turn the valve to the left to begin releasing air and release it at a rate of 2 to 3 millimeters of mercury per second. The first sound or thump noise you hear will be your systolic blood pressure value, and the final sound will be the diastolic blood pressure value. At least 2 measurements should be taken at least 3 minutes apart of each other. These are different classifications and their values via the American Heart Association. The patient in the video had a blood pressure measurement of 118/70 millimeters of mercury, which classifies her as normal.